Today's lecture is about the dietary management of type 2 diabetes. We'll begin the lecture with a general overview of diabetes as a public health problem, and then go into the nutritional management of diabetes as well as self-management strategies to assist those who need to make lifestyle changes. When we look at the incidence and prevalence of diabetes, it's actually increasing. It's a relatively common problem present in approximately 7% of the population, with similar prevalence rates between males and females. But what you can see from this graph is that prevalence is increasing with age. So after the age of 40, there's actually a sharp increase in the proportion of individuals with diabetes. And this prevalence increases or peaks around the age of 75 to 79 years of age. So, with the aging population in Canada, it's not surprising that we can expect to see the prevalence of diabetes rise over the next number of years. So today we're going to focus on the management of type 2 diabetes. As compared to type 1 diabetes, type 2 diabetes is much more common, representing over 90% of the cases of diabetes in Canada. So as a person who may work in the healthcare field or health field, these are the individuals who you will encounter more often. So as you'll recall from your other courses, the predominant characterizing feature of diabetes is insulin resistance. And that insulin resistance results from the fact that the muscle, adipose, and liver cells are not sensitive to insulin. So insulin isn't really able to work in order to help glucose be taken up by the cell. Additionally, there may be insulin resistant deficiency relative to insulin needs. So the body is unable to make enough insulin in order to promote the uptake of glucose into the cell. And both of these features result in a rise in blood glucose levels. So some of the risk factors for diabetes are as follows. From this slide, what you can see is that there are individual characteristics and genetic characteristics that increase risk for diabetes. So, advancing age, so those over the age of 40 are at higher risk, but those with a family history of diabetes and certainly some ethnic backgrounds are more prone to developed or higher risk of developing a diagnosis of diabetes. And then as we move down, you can see that there are several modifiable risk factors like body weight that increase risk of diabetes. So overweight and then excess abdominal weight or adipose tissue in your abdominal area will increase risk. And some chronic diseases also increase risk. So like hypertension and high cholesterol and low HDL cholesterol. So certainly maintaining a healthy body weight and then ensuring that other risk factors are controlled will subsequently reduce the risk of diabetes. And these are the Canadian clinical practice guidelines recommendations for the diagnosis of diabetes. As you're likely well aware, that fasting plasma glucose is one of the primary ways that diabetes is diagnosed. So a fasting plasma glucose greater than or equal to 7 millimoles per liter is required for a diagnosis of diabetes. But then you can also look at long-term glycemic control, and that's estimated or measured through hemoglobin A1C. So those are two predominant markers that are used to diagnose diabetes. So considering the treatment for diabetes, so diabetes treatment is really a long-term management strategy, given that diabetes is both chronic and progressive. So the management strategies are typically involve diet or meal planning, medical therapy, as well as physical activities. And the balance of these three treatment aspects are typically individualized to accommodate for an individual's age and personal lifestyle circumstances. With regards to the overall goals of nutritional therapies, it's ultimately to improve glycemic control or to improve blood glucose levels. And by doing this, ultimately, you reduce one's risk of long-term diabetes-related complications. And those are typically macrovascular complications like heart disease and chronic kidney disease, and then microvascular complications like neuropathy or retinopathy. So these are the Canadian clinical practice guidelines for the nutritional management of diabetes. You can see here at the top of this table, many of these recommendations are related to the guidance statements on Canada's food guide. So you can see, for example, eating at least one dark green and one orange vegetable each day, and having vegetables and fruit more often than juice. So these are the same recommendations for people in the general population who don't have diabetes. So an overall healthy eating pattern is recommended. And then you can see here there are specific recommendations for carbohydrates, proteins, and fats, vitamin and mineral supplements, as well as alcohol, many of which are actually quite similar to the general population. So when we look at the macronutrient distribution or the percent total energy coming from macronutrients, it's as follows. So carbohydrates, contrary to some belief, are actually recommended in similar amounts as compared to the general population. So the recommended range is between 45 and 60%. Very similar, slightly different, but very similar to the dietary reference intake recommendation for carbohydrates. The emphasis, however, in diabetes is to focus on the quality of carbohydrates that one is consuming. When we look at fat as well, we see that the fat recommendations are also similar, less than 35% total energy. And again, the emphasis is on choosing quality fats. And this is a summary of some of those quality indicators for these macronutrients. So for people with diabetes, it's recommended that they consume 25 to 50 grams of fiber per day. This is very similar. This is similar to what's recommended for the general population. However, in diabetes, achieving those fiber recommendations are emphasized because fiber actually helps improve glycemic control and reduce heart disease risk. So this is a population at increased risk of developing heart disease um, because of the adverse effects of hyperglycemia on the cardiovascular system. So achieving this fiber recommendation is quite important. One misconception is often that people with diabetes can't have any added sugar to their diet. But the recommendations actually say that people with diabetes can add sucrose or fructose um, and substitute these for carbohydrates as part of mixed meals, like pasta, for example, for up to a maximum of 10% of total energy intake. So these added sugars can make up approximately 10% of total energy intake in a given day. However, the recommendations emphasize that these added sugars are appropriate only when glycemic control is achieved. So once blood glucose and or lipid levels are not being maintained with up to 10% total intake from sugars, then you might look at cutting back the amount of added sugar in the diet. And finally, looking at dietary fat. So, as mentioned several times, people with diabetes have increased risk for heart disease. So, having healthier fats over unhealthy fats is emphasized. So, limiting intake of saturated fats to no more than 7% of total energy intake is recommended, as well as limiting the intake of trans fatty acids, which even have a more detrimental effect on cardiovascular health. So people with diabetes are often encouraged to choose foods that are lower in glycemic index. And I wanted to spend a bit of time to explain what the glycemic index is and how it can be a healthier way to achieve glycemic control. So very simply, glycemic index is a measure of how quickly carbohydrates are digested and absorbed. And this relates to the subsequent rise in blood glucose levels. So the faster food is digested and absorbed, the quicker the blood glucose levels will go up, and that would indicate a higher glycemic index food. So typically the way that we test a food, the glycemic index of a food, is by feeding that food. So by feeding the test food to a subject or a series of subject, and then measuring their blood glucose levels for 2 to 3 hours after eating that food. And then you get an indication of the rise and the fall of the blood glucose levels over time. So you can see in this graph that in the blue, which is a low glycemic index food, there is um, there is a more gradual increase in blood glucose levels, and then a more moderate reduction in blood glucose levels over time. With the high glycemic index food in the red, you can see that the rise in blood glucose level is much higher, the peak is much higher, and the fall in blood glucose level is different. So that area under the curve is quite different as compared to the low glycemic index food. So many different foods in the food supply have been tested, and typically have been categorized into low glycemic index foods, medium or high glycemic index foods. And clearly the recommendation for people with diabetes is to choose low glycemic index foods more often and high glycemic index foods less often. So this is not necessarily as an intuitive way of eating for individuals because the classification of foods into high and low glycemic index um, it's not as intuitive, and so referencing these tables and really developing an understanding for the where foods fall is very important for individuals to do. So the glycemic index of a food has there's many different features that actually affect the glycemic index, like the structure of starches, the amount of fiber in a food, the presence of other macronutrients like fats and carbohydrates, how a food is processed, and then what the food is consumed with may also affect the glycemic index. So it's important to have a good understanding of which category a food falls in because it's not necessarily fully intuitive. One of the other recommendations is for people who are overweight and obese to lose weight, so to achieve a healthy body weight as defined by body mass index. And the recommendation to lose weight is to really consume a nutritionally balanced and calorie reduced diet in order to lose weight. So, not disrupting the macronutrient distribution of the diet to ensure that the macronutrient distribution is maintained within recommendations, but just to cut calories and increase physical activity. So the recommendation is not necessarily to achieve an ideal body weight, but to lose about 5 to 10% of initial body weight. And the reason is because significant health benefits, can actually be achieved with this reduction, with this moderate reduction of 5 to 10%. And with a 5 to 10% reduction, we can typically see improved insulin sensitivity, glycemic control, and blood pressure and lipid levels are also improved. So achieving for at least this amount is recommended. And one of the final recommendation is about the spacing of meals, so the pattern at which people with diabetes consume their meals. So by having consistent amount of foods at regular time intervals and at regular spacing, with regular spacing of meals, actually helps the body to adapt to the glycemic load of the diet, and it results in better blood glucose control. So this is one of those key recommendations. So far we've been talking about hyperglycemia and how to maintain blood glucose levels, reduce and maintain blood glucose levels. But one of the complications of diabetes is often hypoglycemia. So when blood glucose levels go too low. And typically hypoglycemia will be defined as a blood glucose level less than 4 millimoles per liter. Um, and so this, as you can see on this from this little man on the right-hand side, can result in several adverse effects, health effects, or sensations in the individual. So it can be it can be dangerous. Hypoglycemia can be dangerous, ultimately resulting in falls, and in the absolute worst case scenario, a coma. So this is an important consideration for people with diabetes. Um, Typically, nutrition can help reduce the risk of hypoglycemia. And in particular, this would be achieved through regularly timed meals. So, not skipping meals for an entire day, for example, and having a balance of macronutrients in the diet. So, ensuring that sufficient amount of carbohydrates, fats, and proteins are being consumed. Um, and they can also be avoided through low glycemic carbohydrate choices. So by consuming carbohydrates, um, but choosing the lower glycemic um, options in order to maintain blood glucose levels while consuming food. So within diabetes, there's actually a number of strategies to help individuals maintain glycemic control. Some of them can become very complex and include things like carbohydrate counting, which requires more one-on-one training with a person with diabetes. I wanted to share this tool with you today, which is from the Canadian Diabetes Association, and it's called Just the Basics. So it's designed to help health professionals talk about diet before the individual has had a chance to see a registered dietitian. So just to show you some of the key features of this, so it has an overview of specific nutrition recommendations. Many of these we actually talked about throughout this presentation, but you can see them here in a very consumer-friendly format. Um, just the Basics also presents this alternative approach to eating, which you may have seen before, which includes having half the plate as fruit and vegetables, and then a quarter of the plate as grains and starches, and a quarter of the plate as meat and alternatives. And this is designed to really help individuals consume foods that will be in alignment with the macronutrient, help them achieve the macronutrient distribution for carbohydrates, fats, and proteins. So to summarize the lecture today, diabetes is an increasingly common chronic disease. It has numerous adverse health effects. And I hope that you can now appreciate that diet is central to the management of diabetes and to improve glycemic control and reduce long-term health complications.